Now, how do you get rid of existing plaque or existing tartar? And to do that, you will need to use, I guess we have to begin by defining what is tartar. And in order to explain tartar, I have to explain what is plaque, because tartar is hardened up plaque. Hi, I'm Dr. Ellie Phillips, and I'm here to help you avoid unnecessary dental treatments. And one of the treatments that a lot of people succumb to is quite painful and often protracted long appointments to scrape calculus, or otherwise called tartar, off their teeth. And I'm here to help you figure out how you can avoid having that treatment done, either as frequently or perhaps altogether. And the suggestion I will make straight away is that you begin using xylitol. The use of xylitol is going to limit the formation of plaque. Plaque is an infected material that blows up or expands what is normally a thin film covering your teeth. Have you ever heard of people talk of the skin of your teeth? People used to think that was a funny thing to say, but there is a very thin film that is supposed to be covering your entire mouth. And that film is biofilm. It's made of bacteria wrapped in a protein, and it forms this mesh that is protective. And this mesh, when it's healthy, resists the formation of plaque and resists the formation of tartar. So we want to develop healthy biofilm. That's the first thing that you want to do if you have plaque, tartar, or calculus forming. And xylitol is going to help you do that. You need to have 1 or 2 mints at the end of every meal, after every snack, after every drink. Try to eat and drink in sessions, and then don't eat or drink for an hour or 2 afterwards. During that time when you're not eating and drinking, you will be forming this healthy biofilm, which is what you need. The other thing you can do is use my complete mouth care system. It works in synergy with the xylitol. They work harmoniously together, increasing the effect both of the xylitol and also of the complete mouth care system. Your teeth will be smoother, they'll feel shinier and more slippery, and they will be stronger, and they will resist the formation of this tartar, this calculus. It takes 6 months approximately for most people who have a mouth where they're developing tartar and plaque to get to the point where they're not developing it anymore. So it's not an overnight thing. Some people, it will work more quickly than others, and that depends on a whole bunch of other things called risk factors. I'm not going to go into those right now, but take it from me that you got to be patient, but you got to keep doing this. And if you do this for 6 months, mark it on a calendar, mark it on a diary, and see the points at which your teeth begin to feel better almost within a week or so, and then you'll start seeing less plaque forming. By the end of 6 months, it will be virtually not forming anymore. Now, how do you get rid of existing plaque or existing calculus or existing tartar? That's another issue. And to do that, you will need to use my complete mouth care system twice a day, at least twice a day, not more though than 3 times a day, never ever more than 3 times. But if you use it twice a day, and if you feel that it's feeling good using it 3 times a day, you can. And I'm not going to go through my whole mouth care system now. We've got lots of videos. I've got my website, drellie.com, where you can download a booklet, see exactly what this system is all about. Part of the system, the middle part, is the use of Listerine. And the Listerine that I choose to send people when they purchase a kit, and the one I recommend you begin using first, is Listerine Cool Mint. But if you are trying to get rid of stubborn, subgingival, that means under the gum, tartar or calculus, or even over the gum, tartar or calculus, you may want to switch out the Cool Mint for the original. For some reason, and I have my own theories on why this might be, but I don't know for sure, but the original Listerine is able to loosen and get rid of the subgingival and supragingival, the above the gum, dental plaque, and listen to me carefully here, when it is used as part of my complete mouth care system. Do not ever use Listerine on its own, anyone in my opinion, because when you use Listerine on its own, you are leaving it in your mouth and it is acidic. The pH of Listerine is about 4.2. It is great when it is part of my complete mouth care system. It is part of the equation that's going to work. But if you decide you are doing some extra dissolving of your calculus or something, you are not, because it is acidity that grows plaque. It is acidity that causes the formation of calculus and tartar. It may be acidity because you have acid reflux. It may be acidity because you're drinking Coca-Cola or soda or sparkling waters. You have to get the acidity of your mouth under control. Xylitol is the way to do that, and then to dissolve the existing problems out of your mouth, the calculus and the tartar, use my complete mouth care system, and you may want to substitute the Cool Mint, switch it out, and use the original Listerine and just see what the changes occur. And then you can go back to your dental appointment, usually 6 months, 9 months later, and you may be amazed. You may have a lot less to do, and maybe there's nothing to do.